Why concussion education is important. Research demonstrates that a concussion can have a significant impact on a student, cognitively, physically, emotionally, and socially. Most individuals with a concussion get better in 1 to 4 weeks, but for some, the healing process may take longer. It is possible for a concussion to have long-term effects. Individuals may experience symptoms that last for months or even years. Symptoms such as headaches, neck pain, or vision problems. Some individuals may even experience lasting changes in their brain that lead to issues such as memory loss, difficulty concentrating, or depression. It should also be noted that if an individual suffers a second concussion before they are free from symptoms sustained from the first concussion, this may lead to second impact syndrome, a rare condition that causes rapid and severe brain swelling and often has catastrophic results. Both physical activity and engaging in academic activities that require concentration can cause a student's concussion symptoms to reappear or worsen. It is important to develop strategies to assist students when they return to school, including strategies to assist them as they return to learning and to physical activity. Without addressing correct identification and proper management, a concussion can result in a prolonged recovery, brain damage, and in rare occasions, even death. The Ministry of Education's concussion policy, entitled School Board Policies on Concussion, or PPM 158, recognizes the Ontario Physical Activity Safety Standards in Education's concussion protocol to be the minimum standard for Ontario school boards. All school staff must be familiar with the board's concussion protocol and/or the OFIA concussion protocol, because a concussion can happen anywhere, not just in physical education class or during sports. Depending on individual roles and responsibilities, some members of the school staff will need more in-depth training on certain areas of the protocol in order to support a student who is recovering from concussion. What is a concussion? A concussion is a traumatic brain injury that causes changes in how the brain functions, leading to signs and symptoms that can emerge immediately or in the hours or days after the injury. Signs and symptoms of a concussion can be physical, such as headaches or dizziness, cognitive, such as difficulty concentrating or remembering, emotional and/or behavioral, such as depression or irritability, and/or related to sleep, such as drowsiness or difficult falling asleep. A concussion may be caused by a jarring impact to the head, face, neck, or body, with an impulsive force transmitted to the head that causes the brain to move rapidly and hit the walls of the skull. Can occur even if there has been no loss of consciousness. In fact, most concussions occur without a loss of consciousness. A concussion cannot normally be seen on X-rays, standard CT scans, or MRIs, and typically expected to result in symptoms lasting 1 to 4 weeks in children and youth, 18 years or under, but in some cases, symptoms may be prolonged. Among licensed healthcare professionals, only medical doctors and nurse practitioners are qualified to conduct a comprehensive medical assessment and provide a concussion diagnosis in Canada. In rural or northern regions, a medical assessment may be completed by a nurse with prearranged access to a medical doctor or nurse practitioner. The most current research indicates that baseline testing is not required for post-injury care of youth athletes with suspected or diagnosed concussion and is not recommended.